Imagine waking up every day feeling drained, your body swollen and your urine looking foamy. You visit the doctor only to hear that your kidneys are leaking protein, a condition called proteinuria. Left untreated, it can lead to chronic kidney disease and eventually kidney failure. But what if I told you there's a simple vitamin that can help stop proteinuria fast and even repair kidney damage? Sounds unbelievable, right? In today's video, we'll uncover the science-backed truth about this powerful vitamin and other natural remedies that can support kidney health. If you or a loved one is struggling with kidney issues, this information could be life-changing, so make sure to watch until the end, because we'll not only reveal the best vitamin for stopping proteinuria, but we'll also discuss essential minerals, supplements, and dietary changes that can further support kidney repair. And if you find this information valuable, don't forget to like this video and subscribe to our channel for more life-changing health tips. What is proteinuria, and why is it dangerous? Proteinuria is a medical condition in which an excessive amount of protein is found in the urine. Under normal circumstances, the kidneys play a crucial role in filtering waste products from the blood, while ensuring that essential substances, such as proteins, remain in the body. However, when the kidneys become damaged or compromised, they may fail to perform this function correctly, allowing protein, particularly albumin, to leak into the urine. This condition is often an early warning sign of kidney disease and, if left untreated, can progress to more severe complications. Persistent proteinuria can indicate underlying health problems, including diabetes, hypertension, and autoimmune disorders, all of which can contribute to declining kidney function. Over time, this can lead to chronic kidney disease and, in severe cases, kidney failure, requiring dialysis or a kidney transplant. Causes and symptoms of proteinuria. Proteinuria can be caused by a variety of factors, ranging from temporary conditions to chronic diseases. Some of the most common causes include diabetes. High blood sugar levels can damage the blood vessels in the kidneys, reducing their ability to filter waste properly. Hypertension or high blood pressure. Increased pressure on the kidneys can impair their function, leading to protein leakage. Kidney disease. Chronic kidney conditions, including glomerulonephritis and polycystic kidney disease, can result in proteinuria. Infections. Certain infections, particularly those affecting the urinary tract or kidneys, can cause temporary proteinuria. Autoimmune disorders, conditions like lupus or IgA nephropathy can cause inflammation and damage to the kidneys, leading to protein loss. Common symptoms of proteinuria. High creatinine levels. Elevated creatinine levels in the blood suggest that the kidneys are not functioning properly and may be filtering waste inefficiently. Foamy urine. Excessive protein in the urine can cause bubbles or foam, resembling the froth seen when scrambling eggs. Swelling, also known as edema. Protein loss can disrupt the body's fluid balance, leading to swelling in the hands, feet, legs, and face. Fatigue and weakness. The loss of essential proteins, particularly albumin, can lead to muscle wasting, weakness, and overall fatigue. High blood pressure. Since the kidneys help regulate blood pressure by controlling fluid and electrolyte levels, damaged kidneys can contribute to hypertension, further worsening kidney function. Why is proteinuria dangerous? If left untreated, persistent proteinuria can lead to severe kidney damage. When proteins are lost through urine, the body struggles to maintain a proper fluid balance, which can result in increased swelling, malnutrition, and increased susceptibility to infections. Additionally, chronic proteinuria can cause inflammation and scarring, or fibrosis, of kidney tissue, leading to progressive kidney damage. Decreased kidney function increases the risk of developing chronic kidney disease, or CKD. In advanced cases, kidney failure may require dialysis or a kidney transplant. There's also an increased risk of cardiovascular disease, as kidney disease and heart disease are closely linked. Managing proteinuria requires addressing the underlying condition responsible for the kidney damage. This often involves lifestyle modifications, such as maintaining a healthy diet, controlling blood sugar and blood pressure, reducing salt intake, and avoiding nephrotoxic medications. In some cases, medications like ACE inhibitors or angiotensin receptor blockers, ARBs, may be prescribed to help protect kidney function. The number one vitamin that helps stop proteinuria and repair kidneys is vitamin D, often called the sunshine vitamin, but its benefits go far beyond bone health. This essential nutrient plays a crucial role in kidney function and has been shown to help reduce proteinuria while supporting overall kidney health. Research suggests that many people with chronic kidney disease, or CKD, have low vitamin D levels, making supplementation an important part of managing kidney disease. A 2019 meta-analysis of 12 clinical studies found that vitamin D supplementation significantly reduced proteinuria in chronic kidney disease patients. By supporting kidney function and reducing inflammation, vitamin D may help slow the progression of kidney disease and improve overall kidney health. How does vitamin D help protect your kidneys? Vitamin D provides several key benefits that directly support kidney function and may help reduce proteinuria. First, it supports calcium absorption. One of vitamin D's primary roles is to regulate calcium and phosphorus levels in the body. Proper calcium balance helps maintain the integrity and function of kidney cells, preventing further damage. Next, it reduces inflammation. Chronic inflammation is a major contributor to kidney damage. Vitamin D has natural anti-inflammatory properties that help protect kidney tissue and reduce the progression of chronic kidney disease. Additionally, it regulates blood pressure. The kidneys play a vital role in blood pressure regulation by balancing fluid and electrolytes. Vitamin D helps improve this process, reducing strain on the kidneys and lowering the risk of hypertension, a major cause of kidney disease. And finally, it slows kidney decline. Studies have suggested that vitamin D supplementation can slow the progression of kidney disease by reducing proteinuria and preserving kidney function. This makes it an important tool for those looking to protect their kidneys and prevent further damage. How much vitamin D should you take? The recommended daily intake of vitamin D varies depending on age, health status, and individual needs. However, most experts suggest 25 micrograms, or 1,000 international units per day for general health. Those with kidney disease or vitamin D deficiency may require higher doses, but it's essential to consult a healthcare provider before increasing supplementation. Best sources of vitamin D. There are several ways to increase your vitamin D levels naturally. First, sunlight. Spending 10 to 30 minutes in direct sunlight a few times a week can help your body produce vitamin D naturally. However, factors like skin tone, age, and geographic location can affect how much vitamin D your body produces. Next, fatty fish. Salmon, mackerel, sardines, and tuna are rich sources of vitamin D. Then, fortified dairy products. Many dairy products, including milk, yogurt, and cheese, are fortified with vitamin D. Also, egg yolks, a natural source of vitamin D, although in smaller amounts. And finally, supplements. If you struggle to get enough vitamin D from sunlight and food, supplements are a convenient and effective way to meet your daily needs. If you're finding this information valuable, don't miss out. Subscribe now to support our mission of bringing you more life-changing health tips and empowering you to take control of your well-being. Vitamin K2, the perfect companion to vitamin D. Why vitamin K2 is essential. While vitamin D is essential for various functions in the body, particularly for calcium absorption, it doesn't work alone. To ensure that calcium is properly utilized in the body, you need sufficient levels of vitamin K2. Without vitamin K2, calcium can end up in the wrong places, like your blood vessels and kidneys, instead of being directed to your bones where it's most needed. This misdirection can lead to dangerous health conditions, such as arterial calcification, stiffening of the arteries, high blood pressure, and further kidney damage. Vitamin D promotes calcium absorption in the intestines, but it's vitamin K2 that activates the proteins responsible for directing the calcium to the bones and teeth, ensuring it doesn't build up in tissues where it could cause harm. This synergy between vitamin D and vitamin K2 is crucial for maintaining a healthy balance of calcium in the body and supporting overall cardiovascular and kidney health. How vitamin K2 helps your kidneys. Vitamin K2 plays a significant role in protecting your kidneys and enhancing their function. Here's how it works. Directs calcium to bones. Vitamin K2 activates a protein called osteocalcin, which helps direct calcium to your bones where it strengthens them. This prevents calcium from being deposited in the kidneys or arteries, which could lead to dangerous calcification. Supports kidney function. Kidney calcification, which occurs when excess calcium deposits in the kidney tissues, can severely impair kidney function. Vitamin K2 helps reduce calcification by activating matrix Gla protein, MGP, which inhibits calcium buildup in the kidneys. By doing so, it preserves kidney function and helps maintain overall kidney health. Works synergistically with vitamin D. As mentioned, vitamin D is essential for calcium absorption, but without vitamin K2, this process could lead to calcium deposits in the wrong areas. Vitamin K2 works alongside vitamin D to ensure that calcium is absorbed properly and directed to where it's needed most, the bones. This balance helps protect your kidneys and arteries from harmful calcium buildup. How to get vitamin K2. Vitamin K2 is not as commonly found in the average diet as vitamin D, but there are several natural sources you can incorporate into your meals to ensure you're getting enough. Fermented foods. The richest source of vitamin K2 is natto, a fermented soybean dish popular in Japan. Other fermented foods like sauerkraut, kimchi, and certain cheeses, especially aged cheeses like Gouda, contain good amounts of vitamin K2. Animal-based sources. Vitamin K2 can also be found in animal products, particularly those from grass-fed animals. Sources include egg yolks, chicken, beef liver, and other organ meats. These animal-based sources are especially useful for individuals who may not have access to fermented foods. Supplements. For individuals who are unable to get enough vitamin K2 from their diet, supplements are available. These supplements typically come in two forms, MK4 and MK7, with MK7 being the more bioavailable form, meaning it stays in the bloodstream longer and is more effective in activating the necessary proteins for calcium regulation. Natural remedies to support kidney repair. 1. Reishi mushrooms, nature's kidney protector. Reishi mushrooms have been used for centuries in traditional medicine. Modern research confirms that reishi mushrooms reduce proteinuria and inflammation, protecting kidney cells. Key benefits: reduces protein leakage, protects kidney filtration units, nephrons, lowers inflammation. Antioxidants neutralize free radicals that harm kidneys, supports kidney function, may slow CKD progression. Recommended dosage, 750 to 1100 milligrams per day. Consult your doctor before use. Available in powders, capsules, and teas. 2. Angiotensin receptor blockers, ARBs, kidney protecting medication. ARBs are commonly prescribed for high blood pressure and kidney disease. They work by relaxing blood vessels and reducing pressure on the kidneys, which helps prevent protein from leaking into the urine. Consult your doctor if ARBs are right for you, especially if you have hypertension or CKD. 3. Magnesium, the missing link for kidney health. Magnesium is essential for vitamin D metabolism. Without enough magnesium, vitamin D cannot be properly activated, reducing its effectiveness in treating proteinuria. Magnesium benefits for kidneys, helps convert vitamin D into its active form, ensures maximum benefits, regulates blood pressure, supports kidney function and fluid balance, prevents calcium buildup, reduces risk of kidney calcification. How much magnesium do you need? Men, 400 to 420 milligrams per day. Women, 310 to 320 milligrams per day. Found in leafy greens, nuts, seeds, whole grains, and supplements. If you're struggling with proteinuria, don't wait until it worsens. By incorporating vitamin D, vitamin K2, magnesium, reishi mushrooms, and ARBs, you can help stop proteinuria, reduce kidney inflammation, and improve overall kidney function. Take action now. Did you know that over 25% of adults worldwide have fatty liver disease, and most don't even know it? It's often called a silent threat because it develops unnoticed for years until serious damage has already occurred. If left untreated, fatty liver disease can lead to inflammation, scarring, and even liver failure. The good news? Your body gives you warning signs long before things get critical. In this video, we'll break down 8 key symptoms that could indicate fatty liver disease and what you can do to stop it in its tracks. Make sure to watch until the end because recognizing these signs early could save your life. And if you find this information helpful, don't forget to leave a like and subscribe to stay informed about your health. What is fatty liver disease? Fatty liver disease, medically known as hepatic steatosis, occurs when an excessive amount of fat builds up inside liver cells. While it's normal to have a small amount of fat in the liver, when this fat becomes excessive, it can lead to inflammation and potentially severe liver damage. Over time, if left untreated, fatty liver disease can cause scarring, cirrhosis, and even liver failure. There are 2 main types of fatty liver disease: non-alcoholic fatty liver disease, NAFLD. This type is primarily linked to poor dietary choices and an unhealthy lifestyle, including being overweight, sedentary, or having an imbalanced diet high in processed foods and sugars. NAFLD is increasingly common and is now one of the leading causes of liver-related health problems globally. Alcoholic fatty liver disease, AFLD. As the name suggests, this form of fatty liver disease is caused by excessive alcohol consumption. Drinking too much alcohol puts stress on the liver, leading to fat buildup, inflammation, and damage over time. Both types can cause serious health risks if not managed. However, the problem is that fatty liver disease often doesn't show noticeable symptoms early on. In fact, many people may have it without even knowing. Still, your body does send subtle signals. If you can recognize them, you may be able to catch the condition early. and take action to protect your liver. Common causes of fatty liver disease. Several factors contribute to the development of fatty liver disease, and many of them are linked to modern dietary habits and lifestyle choices. Overconsumption of omega-6 vegetable oils. Oils like soybean, corn, and canola oils are commonly used in processed foods and cooking. While they are often marketed as healthy, when consumed in excess, they can disrupt the balance of fats in the body and contribute to fat buildup in the liver. High intake of sugary foods and refined carbohydrates. Diets high in sugar, particularly refined sugars found in sweets, sodas, and processed foods, can lead to insulin resistance. This condition forces the liver to store more fat, increasing the risk of fatty liver disease. Excessive alcohol consumption. Drinking large amounts of alcohol regularly stresses the liver and leads to inflammation, fat buildup, and eventually liver damage. High fructose corn syrup in processed foods. Fructose, especially in the form of high fructose corn syrup, found in many sugary beverages and processed snacks, can directly contribute to fat accumulation in the liver. Certain medications and viral infections. Some medications, such as steroids and viral infections like hepatitis, can also play a role in the development of fatty liver disease. The tricky part? Many people with fatty liver disease experience no symptoms until the condition has progressed significantly. That's why it's so important to stay aware of your health and recognize the subtle signs that your liver might be in trouble. Fortunately, if you know what to look for, catching it early could make all the difference in preventing long-term damage. 8 signs of fatty liver disease. Fatty liver disease may not always present obvious symptoms, but your body does send out subtle signals that something might be wrong. Here are 8 common signs that could indicate fatty liver disease and help you take action before it progresses further. 1. Right shoulder pain. If you've been dealing with consistent pain or discomfort in your right shoulder, neck, or under your shoulder blade, it may not just be muscle tension. The liver could be to blame. Why? The liver plays a key role in bile production, which is essential for digesting fats. When the liver becomes clogged with excess fat, bile production is disrupted, causing it to become thick and trapped. This leads to inflammation, and the swelling can put pressure on the phrenic nerve running along your right side, resulting in pain in the upper back, neck, or shoulder. If this pain persists, and you can't link it to any other reason, it might be time to check your liver health. 2. Abdominal fat, also known as a potbelly. An expanding waistline, especially around the abdomen, is one of the most common signs of fatty liver disease. Fat starts to accumulate inside the liver, and as it fills up, the excess fat spills over to the surrounding areas, especially around the belly. This kind of abdominal fat, known as visceral fat, isn't just unsightly, it's also dangerous. It wraps around internal organs and increases the risk of serious health issues, including high blood pressure, heart disease, and type 2 diabetes. If you've noticed a significant change in your waistline, it could be an indication that your liver is struggling. 3. Spider veins. If you've started noticing small web-like veins appearing on your skin, it could be a sign of liver dysfunction. When the liver is overwhelmed and unable to process excess hormones like estrogen, it can weaken blood vessels, which may then appear as spider veins. These tiny red or purple veins often have a branching or radiating pattern and are commonly seen on the face, chest, or legs. While spider veins can be harmless in some cases, their presence in combination with other symptoms of liver problems warrants attention. Quick reminder, if you're finding this helpful, be sure to subscribe for more healthy tips like this. For men, an unusual growth of fatty tissue beneath the nipples is another sign that fatty liver disease may be present. An impaired liver struggles to metabolize estrogen properly, leading to hormonal imbalances. Over time, this can cause gynecomastia, the development of enlarged breast tissue in men. If you're noticing unexplained tenderness or swelling in your chest, it might be worth discussing with your doctor, as it could be linked to liver health. If you notice that one of your feet or ankles, particularly the right one, is more swollen than the other, it could be a sign that your liver is having trouble functioning properly. Liver damage affects your body's ability to manage fluid balance, leading to a condition called pitting edema. This causes swelling in the lower extremities, particularly the feet and ankles. If you press on the swollen area and a dent remains after releasing the pressure, it's a clear indicator of fluid retention. This symptom should not be ignored, as it may suggest your liver is no longer processing fluids efficiently. An itchy feeling on the palms of your hands or the soles of your feet could seem minor, but when it's persistent, it could point to a liver issue. When your liver becomes overloaded with fat, it struggles to process bile. As a result, bile can build up in your bloodstream and leak into your skin, triggering an allergic reaction that causes itching. This condition, known as pruritus, is common in liver disease and can cause discomfort and frustration if left untreated. Did you know that an underactive thyroid can sometimes be linked to fatty liver disease? The liver plays a vital role in converting the inactive thyroid hormone, T4, into the active form, T3. If your liver isn't functioning well, this conversion process is impaired, leading to symptoms of hypothyroidism such as fatigue, weight gain, and sluggish metabolism. If you're experiencing these symptoms alongside other signs of fatty liver disease, it might be time to address both issues simultaneously. Feeling drained all the time, even after a good night's sleep, can be a major red flag when it comes to fatty liver disease. When the liver is struggling, it becomes less efficient at absorbing important nutrients, including fat-soluble vitamins like A, D, E, and K. This leads to nutrient deficiencies, which in turn contribute to chronic fatigue and a general feeling of sluggishness. If you find yourself constantly exhausted with no clear explanation, it could be a sign that your liver isn't processing nutrients as it should. Many of these symptoms may be subtle or easy to overlook, but recognizing them early could help you take the necessary steps to prevent more serious liver damage. If you're experiencing any of these symptoms, it's important to consult with a healthcare professional for further evaluation and to discuss potential treatment options. How to reverse fatty liver disease. The liver has an incredible ability to heal and regenerate, but it needs the right support to do so. By making some strategic lifestyle and dietary changes, you can help your liver recover and start reversing fatty liver disease. Here are 6 effective steps to get started. One of the biggest contributors to fatty liver disease is the consumption of inflammatory vegetable oils, such as canola, soybean, and corn oils. These oils are high in omega-6 fatty acids, which can promote inflammation and fat buildup in the liver. To support liver health, ditch these oils and switch to healthier options like coconut oil, extra virgin olive oil, and avocado oil. These oils are more stable when heated and provide beneficial fats that support liver function. Your liver plays a key role in breaking down fats, but when it's compromised by fatty liver disease, it can struggle to process fats effectively. One way to help your liver is by using digestive enzymes. A high-quality enzyme supplement that contains bile, pancreatin, and betaine hydrochloride can support the breakdown of fats and ease the burden on the liver. These enzymes can also help detoxify the liver and improve digestion, allowing your body to absorb essential nutrients more efficiently. One of the most effective ways to reverse fatty liver disease is to reduce your intake of sugar and processed foods. These foods, particularly refined carbohydrates like bread, pasta, and sugary snacks, contribute to insulin resistance and fat buildup in the liver. Instead of processed foods, focus on nutrient-dense options like grass-fed meats, eggs, wild-caught fish, and sulfur-rich vegetables like garlic, onions, and broccoli. These foods support liver detoxification and provide essential nutrients that promote liver health. Milk thistle is one of the most potent natural remedies for supporting liver health. The active compound in milk thistle, silymarin, helps to promote liver detoxification and repair. To support your liver's detoxification processes, consider taking 150 milligrams of milk thistle extract daily. This powerful herb boosts the production of glutathione, the body's master antioxidant, which is crucial for neutralizing toxins and repairing liver damage. Over time, this can help regenerate liver cells and reduce fat accumulation. Intermittent fasting is a highly effective strategy for improving liver health and reversing fatty liver disease. By giving your liver time to rest and repair, you allow it to focus on healing and regeneration. One popular fasting method is fasting for 20 hours a day, consuming all your calories within a 4-hour window. This fasting regimen triggers autophagy, a process where your liver breaks down and recycles damaged cells. Autophagy not only helps cleanse the liver but also promotes overall health and longevity. Start your day with a natural liver cleanse by drinking a combination of apple cider vinegar and lemon water. Mix 1 tablespoon of apple cider vinegar with 2 tablespoons of fresh lemon juice in 500 milliliters of water, and drink it in the morning. This drink helps to boost bile production, which aids in fat breakdown and liver detoxification. Apple cider vinegar also helps balance your body's pH levels and improve digestion, giving your liver the support it needs to function more efficiently. If you recognize multiple symptoms from this list, it's crucial to take action now. The earlier you make changes, the better your chances of preventing serious liver damage. Don't ignore these warning signs. Prioritize your liver health today. If you found this video helpful, don't forget to like, share, and subscribe for more life-saving health tips. If you want to learn more about natural remedies for health, watch this next video.